Hi, I'm Alicia Gonzalez, emergency physician and the director of clinical training at the Bridge Center, a program of the Public Health Institute founded to make it easier for patients to access healthcare when and where they need it the most. One of our main goals is to help people in our communities stop dying from issues related to drug and alcohol use. It's no secret that too many people are dying from drug overdose and harms associated with substance use. And this is especially true for opioids and alcohol. Opioids are a family of medications that bind to the opioid receptor in our brain. That's the part of the brain responsible for controlling pain, but also triggering our reward center. Opioids include medications like oxycodone, hydrocodone, and morphine, but also street drugs like heroin and fentanyl. To understand why so many people are struggling with substance use, it helps to understand a few things about drug use in general. First, if a person is exposed to a certain substance or drugs over and over again, they can develop tolerance, which means that you need more of that same drug or substance to get the same exact effect. And in time, you can develop dependence on that drug. Dependent is what happens when your body gets so used to having a specific drug or substance around that it adapts in a way where when you do not have that drug or substance in your body starts to enter withdrawal. Opioid withdrawal is horrible. It's really painful and causes vomiting and diarrhea, irritability, and sweating. Patients feel really sick and completely miserable. Alcohol withdrawal is also really bad. Patients can get tremors and have vomiting. They can become confused and have seizures. In either case, it makes sense that if your body is suffering from withdrawal, you can't really focus on anything else besides getting your next dose or your next drink just so you can feel normal again. In part, our body craves that dopamine surge that we get from the brain's reward center when we use substances. But once we develop dependence, we're also stuck in a vicious cycle where we have to continue using that substance just to keep ourselves out of withdrawal. Addiction is a term that refers to the behavioral and the social consequences of substance use. When substance use continues despite harmful consequences, it's when the use of a drug or alcohol leads to things like missing work, struggling with interpersonal relationships, or interactions with law enforcement. While addiction and dependence can and do happen at the same time, not all patients with dependence have addiction. And more importantly, none of the people who use substances are adequately described by any of these terms. Remember, every person with substance use disorder is somebody's son or daughter, colleague, coach, teacher, neighbor, friend, doctor. Almost half of the adults in the US know somebody who died from drug overdose. This affects all of us. And the good news is, we have a really great way to help. There are medications that can treat opioid and alcohol withdrawal, prevent cravings, and keep people alive. Focusing on medication in treating addiction acknowledges what science has already shown us to be true, that substance use disorder is a chronic medical disease. Chronic diseases are caused by a combination of factors, including genetics and family history, personal health habits like diet and exercise, but also social determinants of health, things like our access to healthcare, family and cultural environments, even the quality of our local air and water. Some people who struggle to meet healthy food and exercise guidelines may develop diabetes. Some people who smoke tobacco might develop COPD or lung cancer. And some people who use substances will develop substance use disorder. But all of these individuals have something in common. They all require medication to treat their chronic medical disease. The goal of medication in chronic disease is to help the body function normally in the areas that it struggles to do on its own. For substance use disorder, it's the same. Medications for substance use disorder help the body function normally despite its physical dependence on opioids or alcohol. For example, for alcohol use disorder, medications called naltrexone and gabapentin can help to treat cravings for alcohol and decrease the number of days that a person with alcohol use disorder drinks. While the evidence for alcohol treatment is really good, Perhaps the best substance use treatment we have is medication for opioid use disorder, specifically methadone and buprenorphine. When people with opioid use disorder are started on medication, many more of them stay in treatment compared to going cold turkey or trying to quit without medicine. And taking medication can cut the risk of death from opioids in half. Why does medication work better? Well, remember dependence? Patients with opioid dependence physically need some opioid in their system to avoid entering withdrawal. This is not swapping one drug for another, just like patients who develop diabetes and need insulin or metformin, or those with high blood pressure will need blood pressure medication, or people who smoke tobacco and develop COPD or asthma might need albuterol inhalers to breathe. Medications are used to facilitate normal functioning in the body for substance use, just like they are for every other chronic medical disease. And for opioids specifically, this includes decreasing cravings for opioids too. Methadone is a great medication, but it typically requires patients to go to a clinic every single day to get their medication dose. It can also cause sleepiness or even overdose at higher doses. So, while it's a really good and life saving medication, it does present some challenges. Buprenorphine, or bup for short, works like methadone in the body, but without turning the opioid receptor all the way on. This means that bup does not usually cause patients to get sleepy or confused, and it does not cause them to stop breathing. Because of this safer side effect profile, bup can be prescribed by any doctor, and patients can take that prescription home with them. So you don't have to go to a clinic every day to get your medicine, which makes things like going to work or dropping your kids off at school much easier. We often get asked, how long do people have to stay on medication? How long will I be taking methadone or buprenorphine? And the short answer is however long is needed, which might be for the rest of your life or for the long term. Asking when somebody can stop taking medication for their addiction is like asking when somebody with diabetes can stop taking their insulin, or asking when somebody who has COPD will stop needing an albuterol inhaler. Sure, some people with diabetes will be able to make some lifestyle changes and come off of their insulin. And some people will stop smoking cigarettes and in the future no longer need an albuterol inhaler. But that's not true for most people. We often hear from patients that they get told at certain support groups or treatment facilities that they're not sober yet because they're taking medication. This is simply not true. Taking medication for addiction is treatment. Medication is recovery. Forcing people off of their medications is not based in science and actually increases that person's risk of death. And by the way, we know that sometimes people in recovery return to alcohol or drug use. That does not mean the person is weak or bad. Return to use can be a normal part of the recovery journey, and we should never disqualify somebody from medication based treatment, even if return to use happens. Here at Bridge, our team has supported hundreds of hospitals across the US in starting medications for opioid and alcohol use disorder right in the emergency department while patients are in the hospital, and then clinics and ambulances too. Over and over again, we have seen that starting medication is simple and saves lives. We also found that it's what patients want. In one study, when offered the option to start bup for opioid use disorder in the ED, 85% of patients said yes and were started on treatment that same day. And when we start patients on medication for opioid use disorder in the hospital, it more than doubles the likelihood that they will stay in treatment 30 days later. Hospitals are a critical part of the solution in getting patients into treatment, but it will certainly take all of us working together to actually stop people from dying from drugs and alcohol. What can you do to help? First, start by making sure that your local hospital and health system has medication for opioid and alcohol use disorder treatment available for every patient that needs it. While medication is certainly the best way to treat addiction, it can take time for every hospital and every doctor to get the information that they need to update their practice. Call your local hospital leadership and ask, do they routinely start patients with opioid or alcohol use disorder on medications in the ED and the hospital? If the answer is no, direct them to our team at Bridge. All of our resources are free for them to use to ensure that their teams are offering this life-saving medication to your community. Next, share this video with your family and friends. Or if you know of a treatment program that does not support medication-based treatment for addiction, share it with them too. Unlike many other areas of healthcare, substance use has always been surrounded by so much stigma, which makes it difficult to get accurate information out into the community. Sometimes well intentioned people or recovery programs will tell patients that medication is just another addiction or that therapy or counseling are better. While counseling can certainly be an effective part of a person's recovery journey, for opioid use disorder specifically, studies show that counseling alone simply does not work. Medication does. Patients need medication. So we need to help educate others with these facts so that our patients feel empowered and supported in their treatment. Finally, what if you yourself are struggling or have a loved one with substance use disorder? First, please know you are not alone, and help exists. Many cities, counties, and states have treatment locators that you can use to find help. You can also get started at the American Society of Addiction Medicine's patient resource page or call SAMHSA's National Helpline. The helpline is available 24/7 to help individuals and families find access to care for mental health and substance use disorders. There are so many people who struggle with substance use. And trust me, I know substance use is a really frustrating and tough disease, both for the person struggling as well as for their family and their friends and their greater community. But the sooner we can understand substance use as a treatable, chronic medical disease, the sooner we can work together to demand access to life-saving, medication-based addiction treatment as the standard of care in all of our communities. And only then will we ever really see meaningful change in our fight against alcohol and drug-related death. Please join our efforts and let's work together to save some lives.